Welcome, everyone, and thank you for joining us for today's health topic. I'm Rebecca Munnerlin with the Prisma Health Media Relations team. As South Carolina's largest healthcare system, we provide timely wellness information to our communities to ensure you have facts and helpful resources. Summer break is coming to an end soon, and parents and students are preparing for another school year with back-to-school physicals, immunizations, and getting back into the swing of healthy routines. Today, we will focus on the mental wellness of students as they may be dealing with anxiety, bullying, social media usage, and friendships throughout the school year. We have a great panel of experts that will answer questions related to students dealing with anxiety, bullying, and social media exposure. Joining us today are Dr. Blakely Amati, Pediatrician and Medical Director of the Center for Pediatric Medicine in the Upstate, Dr. Brandon Hecht, Family Medicine Physician in the Upstate, Dr. Michael Sierra, Child and Adolescent Psychiatrist in the Upstate, and Dr. Brittany Peters, Psychiatrist in the Midlands. So we have some questions that we're going to float with each of our experts in sequence. And as we go along, if our media partners would like to post some questions in the chat, I will be moderating those and asking those as appropriate, probably toward the end as we cover each section of the topic. And if there are some resources posted in the chat, you're welcome to pull those as well. And if there are some follow-up resources that you would like us to provide afterward, you can just contact me and let me know. We're going to start with the topic of behavioral health specifically, and we're going to begin with Dr. Sierra. Dr. Sierra, our first question is, what are some signs that your child is being bullied, and how can parents help?
I'd like to start by answering what is bullying. First, just to make sure everybody understands that. So bullying is an unwanted behavior that usually happens among school-age children when there's a power imbalance or a perceived power imbalance, and that behavior is repeated or can be repeated over time. And it's good to be able to identify that because both the victim of bullying and the bully themselves can be at risk for some long-term consequences. And there's also different types of bullying. So maybe the most common would be verbal bullying, like hurling insults or trying to make somebody feel bad with their words. There's also social bullying, where you're trying to hurt someone's reputation. So you starting rumors or convincing others to not be friends with a person. And then there's physical bullying, like hitting or spitting on, doing something to someone's body. So signs that a child might be bullied is if they're coming home from school with unexplained injuries, or having their belongings unexplained, stolen or lost or broken. If they start getting really anxious about going to the place where bullying is happening, like stomach aches or faking being sick to not have to go somewhere. Sometimes they might have changes in their eating and sleeping habits, declining grades, or decreased self-esteem and lack of confidence. And sometimes it's hard for children to speak about the fact that they're being bullied at school because it's embarrassing, or they worry that there's going to be some retaliation on behalf of the bully if they find out that they're trying to recruit help from adults. What can parents do? There's a couple of really good websites that I put in the chat. Stopbullying.gov and stompoutbullying.org are two websites with loads and loads of pages and information about this topic, because since there's so many types of bullying and where it can happen and who's doing it and at what age, there's a lot of different circumstances that would be hard to explain all of them here, but that'd be a good website if you wanted to know more. But some kind of general tips is, one is sometimes parents don't know the definition of bullying or the signs to recognize that it's happening, so it starts there. Being someone that's really, really easy to talk to and have open lines of communication with your kids, like I said, it's hard for them to talk about sometimes. Trying to teach children to practice some resiliency, especially if it's verbal bullying, where it's like somebody's using their words to try to make you feel bad. There's ways that we can practice to tell the bully to stop, or if you have a good sense of humor, to laugh it off, or to avoid places where bullying happens if it's a certain place within the school. Bullying tends to happen where there's no other kids or adults, so learning to stay by, identify safe places where bullying is less likely to occur. That might be different if there's safety issues, like with physical bullying. You can't just kind of ignore that or laugh that off. So that would be more of a time to implement either, things with school officials or law enforcement or anti-bullying strategies that are, getting involved with the school board or law enforcement or whatnot to make sure everybody's safe would be a way that a parent can get involved.
Great advice, Dr. Sierra. And I know this is news that any parent would dread. What if you find out that your child is the bully? How do you help in that situation?
Yeah, so that might be something that's hard to find out too, but if your child is one that gets into physical or verbal fights or has other friends that are bullying or has been sent to the principal's office or gotten a lot of detentions or has belongings that you're not sure where they acquired it from, might be good to see if your child, if your child is bullying at school. A lot of what happens in these situations is sometimes there's a bit of denial at first, like, are we sure that that's my child that's doing that? It's a hard thing to admit sometimes, but it's okay. I guess for the first step for a parent would be take a deep breath, but also take it seriously. Brushing it off or assuming that it's a phase can lead to bigger consequences down the line, especially when children get older. So similarly, be able to identify the signs and sit down and have a conversation with the child. Start off by saying, I love you no matter what, but there are some behaviors that have to change. And I want to support you to help improve those behaviors. If the school, I've been hearing these things from the school, and there's certain consequences that you'll face should it be a detention or suspension that I think I'm in support of that consequence, but I don't want you to continue receiving these consequences. Let's try to do our best to learn. Depending on the age of the child, some younger kids don't realize that what they're doing can cause pain to others. So kind of helping them learn empathy and how their actions might be perceived sometimes does need to be taught. It's not something that just happens automatically. There's a certain culture that I think we can all hope to promote where, again, going back to the power differential, if your child is a bully, they're trying to feel like they have more control or power, and trying to identify where that comes from might be interesting, and a very powerful and brave and strong thing to do what would be, instead of being the victim of bullying, to go and find those folks that are having a hard time or getting bullied or not having friends, and to bring them in closer and be kind to them and sit next to them and get them, and stand up to the bully instead of being a bully yourself, but being brave enough to go to the adults when there's safety concerns. To be part of the anti-bullying movement, I think, is actually more powerful, and can, and the parent, and I guess the last point is the parent can try their best to role model this empathy and respect of self-control. There is a power differential between adults and children, and sometimes if we're not careful, adults can act like a bully to the bully to get them to stop bullying, and the cycle continues. But that would be my last point.
Great advice, Dr. Sierra. I think it's got to be equally scary for parents to find out if their kids are on the receiving end or the giving end of bullying, and really just taking your advice to figure out how to navigate through that, I think, is a great place to start. If you find that your child is having a disagreement or some specific type of conflict with their friends, is it okay for a parent to step in? When should that happen, Dr.
Yeah,
Sierra?
I mean, the short answer is yes, but there's a lot of it depends, too. So it is okay to step in, and I think as a general rule of thumb, because again, the disagreements can take so many different forms, but in general, trying to start by passing on wisdom and how they might apply that wisdom in that situation for themselves, I think is a good place to start, so that the child has an opportunity to kind of do some of it for themselves, because that is a great way to build confidence. We don't want to swoop in and take that ability for our child to have a victory away and kind of win the battle for them, because then we might lose the war, and then they don't learn to do things on their own sometimes. But if they're struggling to do it on their own, or the situation is really severe, or there's safety concerns, of course, like we can pick a different opportunity for them to, build confidence and practice some things on their own, but that might not be the time.
Great advice. Switching now to Dr. Peters, what can parents do if their kids are scared or anxious about going back to school, whether that's related to bullying or not? I think there's a lot of reasons kids might be nervous going back to school.
Yeah, absolutely. I think that's a great topic to hit on. And I think where I'd like to start is just to say that most kids experience some level of anxiety returning to school. So I think it can be easy to focus on, oh, it's so exciting, we're going to high school. Oh, it's so exciting, we're going to college, and we also want to normalize, hey, it's okay if you're feeling a little anxious about this, or this isn't, you're having a little bit of trepidation. So some level of anxiety is normal and even helpful and adaptive. I think most people experience anxiety if they're in kind of a new situation or something they haven't done before. And if they don't know what to expect next, that's kind of what generates some anxiety for people. So, and that may kind of come up in different ways depending on the age of the child. So, for example, for toddlers or kids entering preschool, not knowing sort of what to expect in their routine during the day, or, when am I going to have my nap time? When am I going to have my snack time? When's mom coming back? Those kinds of things. So I think the more you can kind of tell them what to expect ahead of time, or perhaps even practice those things ahead of time, the better you can expect that sort of transition into preschool or kindergarten to be. So the more they can anticipate, or the more they can expect, that can be helpful. I think as kids start to get a little older, the things that generate anxiety can be a little bit different. So as kids are getting into more the grade school ages, they may start having more anxiety about performance in school. They may have more anxiety about social situations, or where they are in friend groups and that kind of thing. And so sort of helping kids understand that, school performance is great, but, we're also sort of piggybacking on Dr. Sierra, being a good friend is also wonderful. And, engaging in appropriate social relationships is also a great thing. So making sure you're focusing on lots of different areas of potential strengths is important there. As kids enter middle school, I think we've all been through middle school. This can also be a very stressful time. That's the time when, people are developing at very different rates, physically, emotionally, socially, and at the same time trying to figure out where they fit in. So that can be really stressful and challenging. It can also be the first time where you've sort of, you're getting maybe tiered based on academic performance and those kinds of things. And so that can generate anxiety. And so I think, helping keep an open line of communication about the changes that are going on during that time, and how people are developing at different rates, and this is perfectly normal, and, helping kids understand that can be really helpful. And then I guess the other thing I would like to mention is, kind of, how do you know that this is just typical, like back to school jitters, versus like we are having full-fledged anxiety, we need to do something about this. So if a kid is, telling you like, I just can't do it, I don't want to go to school, I can't go to school, I can't do this, refusing to get out of bed in the morning, not wanting to go to school, that might be a sign that this is a little more than just, back to school jitters. And I always encourage parents in these situations to work with school counselors, school administrators. They deal with lots of kids with anxiety. It's a very common problem. And so working on a plan to help transition that child back into school is really important, because then you're teaching the child, hey, this is scary and you're feeling anxious about it, but it's still something that we can do, and we can still get there, and we can still work through it. The more kids avoid school and don't go to school and, stay home, it's kind of reinforcing the idea for them that, hey, the scary thing is too scary, I really can't do it. And the best thing for me to do is just to avoid it. Again, I would say, again, kind of piggybacking on Dr. Sierra, he had lots of great ideas, keeping open communication with your kids, letting them know that you're there and available to talk to. I think one of the things that I hear the most from particularly middle school, older adolescents, is that, my parents try to give me a lot of advice every time I talk to them, and I really just kind of want to talk to them and tell them how I'm feeling. So the more you can kind of get curious and ask them about how they're feeling, ask them about what they might be struggling with at school or what they're concerned about. I think we all try to use our own experiences to try to help our kids, because we really want them to not repeat the things that we may have done that we would have chosen to do differently, or, we want to impart our knowledge and impart our experience. But sometimes that can kind of shut down their ability to be completely open and honest about their experience. And if you want to give a suggestion or tell them something about your experience, sort of say, hey, I think I've got some ideas about what might be helpful. Is that okay for me to share? And sometimes that can be helpful too.
Thank you for those strategies, Dr. Peters. I think those will help a lot of folks. Switching gears a little bit, how can a parent help their child navigate their first romantic relationships safely? And I don't know how soon parents have to start paying attention or talking about that with their kids, but I'm sure you can give us a little bit of guidance there.
Yeah, that's a great question too. And again, I think that's different for every kid. It kind of depends on, like I said, kids develop socially and emotionally kind of at different rates. So you kind of have to take your cues from your child about where they are and their interest in romantic relationships, and kind of knowing about what's going on with their friends and romantic relationships and what their experiences are, so that you can make sure that you're having a sort of an appropriate level conversation about those things. You hear kids all the way from kindergarten, oh, I have, my boyfriend this and my little girlfriend this, and you have to make sure that you're having appropriate level conversations about that. But I would say certainly romantic relationships in the adolescent years are very typical, very normal experiences. This is a time when kids are really trying to figure out who they are and where they fit in, and engaging in romantic relationships is one way they start to sort of experiment with their identity and how they fit in with other people. And so, I think probably said it 100 times already, but being open and honest and available is one way we certainly want to help kids through those relationships, and making sure they understand whatever questions you have, whatever feelings you're having. I'm in an open, non-judgmental space for you to share those things, because I'm curious and I care about you, and I want to know the best way to support you. I think also modeling good, healthy romantic relationships is important. And so if you yourself are involved in a relationship that you're concerned may not be healthy, or there may be some things that you're modeling that you're concerned you don't want your child picking up on, it would be good to seek help and support for yourself, so that you can make sure that your own relationships are healthy and that you're modeling good interpersonal interactions for your children.
Speaking of healthy relationships, are there some red flags that parents should look out for that could indicate dating in violence in a dating relationship that parents need to look out for? And I know sometimes it's not that obvious.
Yeah, that's certainly true. And, certainly something that we hope that we never have to deal with, but is a good thing to be aware of. And so I think it's important to keep in mind, the different ways that we can be unhealthy in relationships. And so that's, both physical, it's verbal, potentially emotional, and sexual inappropriateness. And those are all sort of different spheres or ways that relationships can be unhealthy. And those can certainly occur in teenagers, just like they do in adult relationships. And so I think that that's an important thing to look out for. So certain individuals or certain young people are going to be a little bit more at risk for engaging in unhealthy relationships. And so Again, if kids have lots of modeling of unhealthy relationships from adults or people that they're close to in their lives, that's, one risk factor that they may themselves then get engaged in an unhealthy relationship. Kids that experience higher levels of anxiety and depression are more likely to get in unhealthy relationships. Individuals that use substances, drugs, and alcohol, people that use substances together, that's a risk factor for engaging in an unhealthy relationship. And then another, potential risk factor for what we call intimate partner violence or domestic violence would be engaging in sexual activity at a very young age, or starting to have multiple partners at a very young age. Those are some potential risk factors for people that they may get into a relationship with someone that becomes very unhealthy. And so I guess, the next question would be like, what do we look for? Because that's not always easy to see. And teenage relationships can be rocky. So there's no question about that. But if your teenager is engaged in a relationship that's constantly on again, off again, on again, off again, that might be a little bit of a trigger that there's something going on in the dynamics of that relationship that needs a little bit of a closer look. And again, similar to the bullying topic, intimate partner violence is often about control and one person trying to exert a large amount of control over another. And so this kind of back and forth of on and off again can kind of be about control. Certainly if you see any unexplained physical injuries or physical injuries that you're getting explanations for that don't make a lot of sense, that would be a concerning thing for sure. Any worsening of anxiety or depression in a person who's in a close relationship or having a close romantic relationship. And that's not always the case. It's not to say, if your child's in a romantic relationship and they're becoming anxious and depressed, that there's got to be some, violence going on, but just something to look out for that you might want to be having more conversations. If they're spending an excessive amount of time with each other and just completely ignoring family and friends, that would be another sign. Kids, when they get in relationships, they're going to want to spend more time together. They're going to want to go do things together. But if they're, just leaving out their best friend all of the time, or not wanting to do any activities with the family, those are things that we might want to look at this a little more closely.
Signs that they're being isolated to a certain extent by their partner potentially.
Yes, absolutely. And then it changes in like school performance or not doing activities that kids usually enjoy. That can be a sign of depression, but it could also be a sign that they're not spending time doing the things that they used to like to do, or not spending time getting their schoolwork done because their partner is controlling their activities or behaviors. So I would say that's kind of a list of things that you can look for in those situations.
Thank you. I think you covered this question pretty well about how romantic relationships can harm the mental health of teenagers. Is there anything else you'd want to add there?
I guess, I think we do focus a lot on romantic relationships, but I think it's also important to consider non-romantic relationships and the health of those relationships. I think we're trying to teach our adolescents and teenagers about healthy boundaries and healthy relationships, even, among friends and all our relationships. And so, really knowing your teenagers' friends and sort of what they're experiencing, what they're going through, how they interact with one another as well. I would say when I'm talking with kids, romantic relationships does take up a lot of the time in terms of things that are stressful or may cause difficulty. But friendships, certainly it can be distressing and cause some conflict as well.
That all makes sense. I think it stirs a lot of memories in everybody, just on the things and the amount of drama we all remember from adolescence, and trying to separate the drama from the real issues that we need to pay attention to.
Absolutely. Mm-hmm.
Yeah. Well, thank you so much, Dr. Peters. That was really helpful. We're going to switch over now to pediatrics and speak with Dr. Amati. Dr. Amati, I'm sure this question just arose so quickly in the typical childhood these days is, how do I know if my child is ready for a cell phone? That seems like a big point in kids' lives now.
Yeah, it's a big point because you're giving your child a lot of responsibility and freedom, and it's also a big financial commitment for your family. And it's a decision that I've been through personally in the past year. My husband and I struggled with it with our son going into middle school. So certainly children see other kids with cell phones, and it's natural for them to want one themselves. As parents, we have to balance the opportunity to have contact with our students and our children when we need to get in touch with them when they're traveling, home from school or in between activities or between different households, with the new distraction that they now have in their hand, and potentially the social drama that can come with that as well. So lots of things to think about. And sometimes I think a good bridge to a cell phone, or there's a lot of smart watches now where you can pre-program in a few key contacts, your child's parents, emergency contacts, other family members, where the child can be reached or they can call, and we can see on GPS where the child is. So that might be a good bridge to a cell phone for some families. There is a wonderful phone ready questionnaire that AT&T created, and that is also available on the American Academy of Pediatrics website. And it goes through some key questions for you to think about and reflect on as you're making this decision as a family. The first is, why does your child want a cell phone? What are they hoping to get out of it? Is it to be in more contact with you, or is it to have more opportunity to game? And how responsible they are. Are they responsible not only for their own objects? Do they lose items a lot? But how responsible are for their actions as well? So when there's a mistake that's made, do they come to you and talk through it? Do they hide? How impulsive are they? So lots of different things to think about. And then how willing are you as a family to really sit down and make a good family media plan and set up parental controls and locks and have ongoing monitoring of your child's cell phone? So there's a lot of things to think about. Another resource for families is a template for a family media plan that's also sponsored by the AAP, where you can sit down with your children and think through media balance, think through how you're going to have locks on the phone so that your child cannot have access to their phone during school hours. Maybe it includes that you're going to keep the phone in the kitchen at night so that they can't charge it in their room and have access to their phone overnight, to be up late and have that blue light in their face and really disrupt their sleep. How you can be a good citizen online. So how can you practice kindness and empathy and not be a cyber bully, and how you can learn that everything that happens online is permanently in cyberspace and we have to make good decisions. And then, are there specific screen-free times and screen-free zones in your house? The different cell phone companies have apps and things like that to help with monitoring of cell phones for children, as far as family sharing, things of that nature, and other parental controls. It's also important to think about ways that you can check in periodically with your child. What group chats are they in? What's the latest texting lingo that they're using, or combination of emojis to communicate with their friends? What games and apps are they using, and what are they reading about on their phone? So lots to think about, but certainly it's here. So
Yeah.
we need to know how to help our children be online safely on their phones.
Thank you so much for pointing us to those resources. And we'll try to share as many of those in the chat or in follow-up as we can. And I think we've realized that phones and laptops are very much two-way portals. And with that in mind, talking about how to be safe on social media, because not only are our kids exposed to things, just, the social media apps that are out there. They're exposed to the people that are coming in through those apps that parents might be a little nervous about. And so do you have some tips for that? And I want to, I'll also mention here that it looks like we may run over on our time just a little bit. We are covering a lot today. So if y'all will bear with us, hopefully nobody will get knocked off before our time is up. And thank you everybody for your patience in getting through these important topics. But again, back to you, Dr. Amati, talking about keeping kids safe on social media.
Sure. I mean, social media, there's new apps every day. So just being up on what our teenagers and our children are asking for access to, which ones they have access to, text messaging, online forums, chat rooms, video games. So you can chat through online gaming communities. There's a lot of ways for children to have a presence on social media and also to have others be able to contact them. So again, part of that digital citizenship, you need to know that, everything on the internet is not how it is in real life. So people can look like someone else and not be who they say they are. There's also this sense of, digitally distorted reality, not just someone posing as someone else, but distorted views of body images with filters and posing and, just people looking unrealistically thin or muscular. There can be distortion of the rates of risky behaviors, a lot of exposure to violence if you're watching the wrong things, and the perpetuation of harmful stereotypes. So there's a lot of ways for the sense of reality to be distorted. So just having an honest and ongoing conversation with your children about what they're exposed to online. Being online also sets our children up for being victims of cyberbullying. So we've talked about bullying already. The scary thing is that now it's happening online. It's happening persistently online. So not just at the playground, it's following our children home, and it's hard to notice because it's happening in these apps and forums that we may not see our children are being exposed to. So some of the tips about changes in your child's behavior and things of that nature that we talked about with regular bullying would apply to this situation as well. But just hammering home the importance of us really needing to set clear expectations about digital behavior and online reputation, being clear about what content can be viewed or shared, identifying which apps are appropriate for our children, establishing rules around time and which apps and websites can be viewed, and modeling positive behavior and just having that overall surveillance about what's going on in our children's digital world.
Right. Thank you so much. I appreciate you summarizing that for us. We're going to shift a little bit back from the virtual and digital world back to the physical world. Let's talk a little bit about kids who are looking at a challenge going into the new school year. They're going to a new school. How can a parent help their child make that transition a little easier? Because they might be the oldest kid in middle school going up to being the youngest kid in the high school, or they might be starting school for the first time, or they might be moving, to a new school district,
Right.
and starting with a whole new community. How do you advise parents on helping kids through that?
That can be really tough. We've already talked about how we're creatures of habit. We all love routines and we like to know what's coming and what we can expect. So those transitional times can be anxiety provoking, but they can also be great opportunities for growth and meeting new people and trying out new things. And so I think first, just having a positive attitude with your children about the opportunities that may lay ahead is a good first place to start. If it's going from elementary to middle school, they probably have friends that they can lean on as they make the transition to the new physical space. Moving to a new school or a new district, a new state can be especially difficult because everything is new for the first time. So it depends on what the transition is, but certainly parental involvement with the move can be very helpful. Going to the open house, touring the school with your child, meeting the teachers. In middle school where there's multiple teachers, reaching out to form early that open line of communication, really encouraging social relationships. And certainly that will look different depending on the age of the child. It may be play dates. It may be that you have, you know, a meetup at the park with kids from the school, or you stay after school and play on the playgrounds with children. In middle school, it may be, you know, you are working with your child about getting them signed up for after school events that they're interested in so they can find like-minded peers. That in itself is a protective factor against bullying. So you can really help a lot by helping them get plugged in with what they already like. And then just listening out for things that may not be going so well and having that open conversation. It's going to be stressful, recognizing that that is natural, and what's particularly problematic right now. Let me listen to you. I loved what Dr. Peter said about you don't have to insert what your own experience was, but just be that soundboard and listen to what's causing stress, and just seeing sometimes that's enough.
Right,
So,
right.
yeah, just staying open and being as involved as possible is helpful.
Terrific advice. And finally, one last question for you, Dr. Amati. And this is throwing back to the very youngest kids who are looking at starting school. Parents thinking about whether or not they should hold their child back, to whether or not they should start or wait a year to go to kindergarten. How do you help parents navigate that decision?
Yes, so in South Carolina, our cutoff for starting kindergarten is you have to be 5 by September the 1st. So first, you just need to start considering registration when you're getting to that point in your child's life. Some parents prefer to do a private kindergarten or keep their children home before kindergarten. But regardless of what y'all do with that kindergarten year, based on when they're born, when they go to the school district, they will still be eligible for first grade the next year. So it's really hard to actually hold your child back. There are some extenuating circumstances that I don't think we have time to get in today, but having, again, really open and honest and early communication with the school that you're planning to register your child at about the particular concerns you have can be helpful in planning a successful start to school. Everyone that's coming into kindergarten is learning how to be in a classroom and to make friends and to be patient and to sit in circle time for the first time. So there's a lot of social things that are going on that everyone can benefit, and it really sets the foundation to learning in first grade. During the pandemic, my son was in kindergarten, and so listening to him on the call, most of what they did all day was sharing, and there wasn't a lot of high, heavy math and reading going on. So if people are nervous about getting their child into kindergarten, it's okay. It's a really fun environment, getting them ready to love school always. There are some things that we can do as parents before it's time to kindergarten to help them succeed. I like to talk about the 5 R's of early literacy. So reading from day one, having them exposed to as much language as possible, having that be a special time between you and your child. Rhyming that we hear with songs. Dr. Seuss is famous for a reason, lots of good rhyming. Routines, we've already talked about how important those are for us all to feel successful and stable. Rewards, we want to have a positive approach to our children. And then relationships, knowing that our children can trust us as stable, nurturing relationships. And then the other thing I will say is don't forget that when you go to kindergarten, you need your vaccines. So we are taking children now for their 4-year-old vaccine. So 4 and 5-year-olds need to be calling the pediatrician right now to get ready for school.
Great reminder. Thank you so much. Okay, now we're changing over to family medicine, and we're going to speak to Dr. Brandon Hecht. Thank you, Dr. Hecht, for hanging out there for a few minutes while we get to your topics.
Absolutely.
Yeah, we'll start with, how can you protect your child at school if they have a severe food allergy?
Yes. So this is so important and often anxiety producing for many parents. On one hand, with a severe food allergy, they may need special meal considerations provided. And if you go to your child's school district website and follow links for parent resources and then health services, you can find the forms needed to fill out by your physician or a nurse practitioner or physician assistant that your child sees for primary care, to have those forms filled out so that the proper information can be given to the schools, whether it be the classroom or the cafeteria, to provide meal accommodations for those children. Second, they may also need a medication administration form for school. If they have a food allergy that is an anaphylactic allergy, where they have trouble breathing if they are exposed to the food, then they need to have a medication form completed for a epinephrine pen, or maybe for an albuterol inhaler to be administered at school by the school nurse. For older children, sometimes they can be allowed to carry the medications with them if they've demonstrated an ability to administer it to themselves and it's not a danger for them to have around other kids. And there are forms to complete for self-administration of medications as well on that website.
And that varies by school district, I assume, a little bit. So you just need to check in with your local school district rules.
That's right.
Perfect. And you touched on this. Our next question was, how do schools typically handle food allergies? So you covered that really well. Do you ever caution that separating kids out because of their allergy can cause them to feel isolated or different or picked on in a way that a type of attention that kids don't particularly like?
Yes, so certainly kids are very quick to notice how they're viewed socially. And generally, I find that there is not a big social stigma for kids. The kids have the fear of it, but they don't often experience that in reality at school. For one, most kids, their peers are going to be equally concerned for them, and it may even be better at protecting them than they are themselves when they're aware of what they're not allowed to eat. And then it can also be important for parents to just reassure their children that their safety is worth some challenges with the transition, and that they are going to be better off with the proper people knowing their teacher in the different classroom settings, the cafeteria, the school nurse, kind of knowing about their allergies so that they can have some peace of mind at school and feel safe.
I imagine the same holds true with kids who maybe, for instance, type 1 diabetics. They also have medication and they have to pay attention to certain things during their day. Similar advice for them?
Absolutely, yes. So, depending on how long they've been a type 1 diabetic, those children can be very adept at managing their diabetes, but there will be an incremental role for the school nurse to be involved in their care as well, particularly if they're not yet on an insulin pump and they're having to administer injections. Thankfully, the combination of transcutaneous glucose monitoring and insulin pumps has become even more user-friendly with enough education that kids can have some peace of mind that they're not going to be in danger while at school. But the types of foods that need to be avoided in their diet at school can be indicated on those special meal forms that the school districts have.
Right. Switching up a little bit, we talked a lot about the younger kids. What about your patients that are young folks who are heading to college? Do you sort of give them a prep talk when they have their annual visit with you about just their health in general and how they can do things like, I don't know, avoid the freshman 15 or those things we used to talk about going to college? What advice do you share with them?
Yes, absolutely. And one of the joys of family medicine is that I can give advice to them as they go and then continue to reinforce it as they come back as adults. And so it's, I would say the 4 top things that I encourage them about are to avoid substance abuse. Don't fall given to peer pressure with whether it be nicotine or marijuana or other illegal drugs at school. Their brains are still developing. We don't know, what profound impact those substances could have on them and their continued development. So just don't do it. Same with alcohol. Meant to mention that one. And then also practice safe sex if they're going to be sexually active. Use protection. There are not cures for some of the sexually transmitted infections, and that could affect them for the rest of their lives if they're not careful. And then I encourage them to prioritize sleep. They need to continue to sleep 8+ hours every night, and it's going to be important for their academic success. And there's a lot of good evidence that adequate sleep is important for weight management. That if their bodies are constantly running on empty, they're going to do a lot more emotional eating, stress eating, not paying attention to their portion sizes, late night snacking, all the bad things that can lead to that freshman 15. And then on that point, the school cafeterias can be somewhat of a playground when it comes to, I can have ice cream at every meal if I want to, so just encouraging them to not do things that they wouldn't have done when they lived at home, to continue to try to choose healthy foods, lots of veggies, some fruits, watching their portions on all those sugary foods and starchy foods like pastas and rices and all that. And then the 4th thing that I encourage them to do is to make sure we're up to date on vaccines, whether they have had COVID-19 or not during the pandemic. Would it be appropriate for them to be vaccinated against COVID-19 going into college? Would they have they completed their meningitis vaccine series as they enter a residence hall setting where they're going to be living in close quarters to people 24 hours a day? That's an important one to do. And then going along with the safe sex topic, considering both boys and girls having their HPV vaccine completed in order for them to help prevent cervical cancer, but also protect against other conditions that HPV, the human papilloma virus, causes, that they could avoid if they were properly vaccinated.
And now's the time to get those done, right?
That's right. Yes.
Yeah.
That's right. Yes.
So, so call your provider and make an appointment and get that done. Thank you so much, Dr. Hecht. Great advice. I am looking for any questions in the chat from our media partners. They've been pretty quiet so far. I think we can really bring things to a close. Thank you all so much for covering this topic so thoroughly for us. I know there's a lot to say about everything and we couldn't possibly hit it all, but we'll have an opportunity, I think, to do some follow-up chats on specific topics, and we would love to have you all join us again. Thank you so much to our experts for your time today and to our media partners for joining us. I wish everybody enjoyment of these last days of summer. Stay cool, and we wish everyone a healthy and successful school year ahead. So signing off. Thank you all again.